having pain in my hands, the knuckles here,
Mm-hmm.
on both hands. It started about 4 months ago. And I've had this before, but it just started back up 4 months ago. And I was also having some chest pains, which kind of ran up even the side of my head, my ear.
Mm-hmm.
Well, it was more so in the mornings, but it kind of come on, and then later on the day it wasn't as bad, but it's pretty much had pain all day in my hands.
So how was it affecting your life?
Well, I have a woodworking shop. I do work out there a lot, and it was limiting me on what I could do out there because my hands were hurting, as far as like, the sanding and then using planes and stuff. And, I built cabinets, and it was hard to do that when my pain in my
Mm-hmm.
hands.
Mm-hmm.
And putting little bolts together, putting screws in was more difficult.
Mm-hmm. You also shared with me, apart from the pain, that you couldn't make a grip or you had stiffness in your hands.
Yeah, hands are really stiff, hard to make a fist.
Mm-hmm.
They're not closing.
Mm-hmm.
And both hands. In fact, this hand's worse than this one still, but it's better now.
Mm-hmm. So what did you do for your hand pain before coming to me, before we intervened a month back?
And I went to a rheumatologist, and he gave me a prescription to take for a little over a month. I believe it was steroids.
Mm-hmm.
And
Yeah, you were taking prednisone. Yeah.
And it didn't actually do anything.
Mm-hmm.
I couldn't tell much difference.
Mm-hmm.
Maybe a little bit, but not much.
Mm-hmm.
And then when I come to you and started doing the exercises, the neck exercises,
Mm-hmm.
it completely went away.
Mm-hmm.
Both of those.
So what exercises did you do? Can you show us? How did you do your exercises?
A neck exercise where I sit there and bring my chin back
Mm-hmm.
and then lean up.
So that is McKenzie's cervical retraction and extension.
Yes.
Okay.
Doing that and just kept, and I was doing like 20 times, 20 reps, trying to do 6 times a day. So I was doing quite a few.
Mm-hmm.
And the first day I was doing that, and I was sitting out in my shop and I was doing quite a few, doing the next exercise. And I noticed that my hands where I could actually make a fist and my knuckles down there. And I haven't been able to do that in 20 years. And that's the first time in 20 years. And after doing the neck exercises for maybe, an hour or two, just doing them and then resting and doing them, I noticed that difference in my hands, flexibility.
So flexibility improved
And the pain was gone.
the pain is gone.
Yeah.
Okay.
And it was gone that day, I think. I don't think I've had a hand pain since then. And
So I remember you sending me a picture of
I sent you a picture of my hand,
your
making a
hand
fist.
making a fist. Yeah. So you couldn't make that fist for a long time?
Oh yeah, I bet it's been 20 years since I've been able to. When
Yeah.
you turn the knuckles under.
Right. Oh, you also had chest pain. Have you had any more episode of
I
chest
haven't
pain?
had any more chest pain.
Right. And I want to clarify here, chest pain, before you suspect that it is coming from the neck, you have to rule out all the serious causes. And also on the history it matters. But I also did a stress test just to cover bases.
Right.
And the stress test was negative for your heart. So you're not having any more chest pain either, right? Okay. Last month, when I was trying to engage you to do the neck exercises for your hand symptoms, what were your thoughts? What was going on in your mind? Or
I was a little reluctant. I couldn't see how that would work or do anything. I've been going to a rheumatologist for 40 years, taking different medicines, anti-inflammatory and aspirin and stuff for arthritis. But it was hard for me to think that a simple neck exercise would eliminate the pain in my hands, but it has.
Mm-hmm. Yeah. But I want to also share with you that actually over the years, you have been coming to me for a number of years, and you have done same retraction exercise for different complaints over the years. So one was, remember at one time, 5 years back, you had a dizziness?
Yeah.
Can you describe that dizziness episode and what we did for your dizziness?
It's just kind of got gradually worse. And when I would get up in the morning, I was kind of dizzy, and there for a couple days, I couldn't work. Couldn't go anywhere and do anything. I was pretty much sitting in the chair all day because when I stood up, I was dizzy. So I came to see you, Dr. Agarwal, and he had me pick up some tongue compressors,
Right.
and I was really shaky. He had me sit down, and they took my blood pressure, laying down, sitting down, standing up, and anyway. And then he did the exercise, the chin, pushing my chin back, and it was really uncomfortable pushing on it for about 5 minutes, maybe a little longer. Then he had me stand up. He threw the tongue compressor down, picked them up, and I wasn't dizzy. And I couldn't believe that just that neck. Should I talk about why I think it happened?
Yeah. Go ahead, please.
Well, it so happened that right at the same time I had bought an iPad. Never had one before, but I bought an iPad. And so I was sitting.
So when did you buy the iPad? 2015?
Yeah, I was right. So I laid the iPad on the kitchen table, and I was Facebook, YouTube, looking at it. And after a couple of weeks, my neck started hurting, and it was the bad posture that Dr. Agarwal talked about. So I'm a woodworker. I made me an easel to put my iPad up on the easel, and with that and the neck exercise, I haven't any more dizziness.
So you still use the easel?
Oh yeah.
So you use the iPad, you put the iPad on the easel?
It sits up higher, I'm not looking down like this at the kitchen table or holding it, looking at it.
Right. Yeah. See, our spine is not designed to sit for hours and hours in the day, which we are doing right now. Yeah. And that's why we are having so many issues. So I also want to share with you, I'm looking in your chart, at one point you also had your forehead pain on the left side. Yeah. And that was also from the neck. Remember, we did the same exercises for your neck, and let me see what else you had. I'm going in your past medical history.
Lower back pain.
Yeah, for lower back pain, the posture. Oh, you also had last year shoulder pain. Can you tell us about your shoulder pain?
Yeah, it was in my joint and the shoulder was sore.
Right. And
I thought it was, my buddies had a rotator cuff surgery and stuff, and I was thinking, well, that's probably what it was. But with the exercises, it went away.
So what exercises did you do for your shoulder pain?
Well, I was just doing
you were just doing retraction. You were not going into extension.
I wasn't going back.
Yep.
Just doing back.
So that was in July of 2020, your shoulder pain. How's the shoulder pain now?
I haven't really had any.
Yeah. So what I'm trying to share with you is that the same mechanical issue in your neck has presented with different clinical presentations over time in the same individual. So it can present as dizziness, it can present as chest pain, shoulder pain, and most recently the hand pain. However, only a medical doctor can differentiate if it is mechanical or not, because first you have to rule out other serious causes.